Welcome to the 32nd conference of the Italian Society for Palliative Care. We are here in Riccione. It's a very exciting place and we have a lot of people attending the conference. But today I'm honored and very pleased to interview Professor David Hui. And first of all, David, can you introduce yourself?
Hello, hi, I am Dr. David Hui from the University of Texas and the Anderson Cancer Center. I'm a palliative care specialist and a medical oncologist. I'm very pleased to be here at your conference.
Oh, thank you so much. So we would like to exploit your experience and your knowledge about the palliative care development around the world. And so how would you describe the international evolution of palliative care nowadays around the world?
Yeah, well, I am so very encouraged to see that palliative care is growing as a field and maturing as well. I mean, in terms of the clinical development, programs are becoming more robust, more people are contributing to this area, looking after patients. Our workforce is not only growing, but also becoming more specialized in terms of the knowledge. Partly because of the stronger educational programs as well. For example, Italy, I heard, a few years ago, established palliative care as a discipline, and that allow us to train more individuals who are dedicated, to this field. I'm also seeing a lot more research coming up, and that's very exciting. I think as a discipline that provides high quality care, we need to have the scientific basis for our practice, and I think through high quality research we are doing more and more of that. So I think overall, not only the clinical, the educational and the research perspective are improving, I'm also recognizing there's a growing advocacy around the world. Certainly more collaboration with the non-palliative care clinicians, with the politicians, kind of all gathering together to say, wow, our patients have tremendous supportive care needs, and this team of people can really help everyone in making some better outcomes. So I'm very encouraged to see that. It is hard work, but I think the many decades of effort from the pioneers in this field have led to this point, and I'm excited to see going forward, what's the next steps. Yeah.
Terrific. Thank you so much for that. I have one more question for you. Today we all at the conference enjoyed your lecture that we had in the plenary session. And now I would like to talk about the audience that is now attending this interview. What does it mean for you providing palliative care always and everywhere?
Yeah. Well, I think as we realize that patients with advanced illness, they literally have supportive care needs at many different times throughout the illness trajectory. Time of early diagnosis, and then at the end of life, but even in between. And not only them, but also their caregivers. They have concerns at home. They have questions that are unanswered. They need the reassurance. They also sometimes develop complications requiring them to be in the hospital. And those who are sicker at home, they need home care. So being able to provide this palliation throughout the illness trajectory, but tailored to the individual patient needs is key. Because not everyone needs palliative care at every single time, but recognizing when do they need more and be able to support them properly is the key. And I think this is kind of where our field is moving to becoming more personalized and more available through technology, through a bigger workforce, through the evidence that we can provide this coverage and improve patients' quality of life along the way.
Thank you so much. This is so inspiring. I'm really looking forward to see this put in practice in Italy as well, where we are struggling with the organization. But on behalf of the Italian Association, all our associates, and above all patients, colleagues and their families, I want to thank you very much for this, for being here with us, for sharing your knowledge and your enthusiasm in clinic and research. Thank you so much, David.
Yeah, thank you. It's really been an honor, and I think your organization is doing wonderful work promoting palliative care in this country, and I'm very excited to see the more of this development as we continue to grow as a field. Yeah. Thank Thank you.